Our story of antidepressants begins in the 1950s when tricyclic antidepressants or TCAs were discovered by accident. These drugs offered the first real hope for people with depression, shifting the view from purely psychological causes to a biological basis. TCAs work by increasing levels of norepinephrine and serotonin, key neurotransmitters for mood, by blocking their reuptake in the brain. This helps improve communication between brain cells and can lift depressive symptoms. However, TCAs aren't very selective. They affect other chemicals in the body, leading to side effects like dry mouth, drowsiness, weight gain, and even heart problems. Overdosing on TCAs can be fatal, making them risky for some patients. Despite these drawbacks, TCAs proved that depression could be treated with medication, opening the door for safer, more targeted drugs. Their discovery marked a turning point in mental health care. Inspiring decades of research, the limitations of TCAs made it clear better, more precise treatments were needed. This realization set the stage for the next generation of antidepressants. The journey to safer, more effective medications had begun. TCAs changed everything, but the search for improvement was just getting started. While TCAs were making waves, another class, MAOIs or monoamine oxidase inhibitors, emerged, also by chance. MAOIs work by blocking the enzyme that breaks down mood-related neurotransmitters, keeping them active longer. But the real revolution came in the late 1980s with SSRIs, selective serotonin reuptake inhibitors. SSRIs, like Prozac, target serotonin specifically, making them more precise and generally safer than older drugs. Their selectivity means fewer side effects, so more people can stick with treatment. SSRIs quickly became the most prescribed antidepressants worldwide, making biological treatment mainstream. It's important to know that both MAOIs and SSRIs take several weeks to work, as the brain gradually adapts to higher neurotransmitter levels. This slow process is why patience is key when starting these medications. SSRIs made antidepressant treatment more accessible and tolerable for millions. The focus shifted to finding the right balance between effectiveness and safety. The evolution of antidepressants was well underway. MAOIs can be effective, especially for atypical depression, but they require strict dietary restrictions to avoid dangerous spikes in blood pressure. SSRIs are safer but can cause side effects like nausea, insomnia, and for some, sexual dysfunction. Withdrawal symptoms can occur if SSRIs are stopped abruptly, so doctors recommend tapering off slowly. The decision to use antidepressants is always a balance of risks and benefits tailored to each person. For many, the chance to feel better outweighs the side effects. The goal is to maximize benefits, like improved mood and energy, while minimizing downsides. Open communication with a healthcare provider is essential. Finding the right medication often takes time and adjustment. Modern treatment is about personalizing care for the best possible outcome. The right approach can be life-changing. Medication isn't the only answer. Cognitive therapies are powerful tools for recovery. Cognitive restructuring, developed by Aaron Beck, helps people identify and challenge negative automatic thoughts that fuel depression. Patients learn to keep thought diaries, spot patterns, and test the reality of their beliefs. By replacing distorted thinking with more balanced perspectives, they break the cycle of negativity. Rational emotive behavior therapy, or REBT, takes a similar approach, focusing on how irrational events themselves cause distress. The ABC model, activating event, belief, consequence, guides patients to dispute rigid, unrealistic beliefs. Both therapies teach practical skills to manage thoughts and emotions. Change takes practice, but these methods empower people to reshape their mental habits. Cognitive approaches can be used alone or alongside medication. They offer hope and practical strategies for lasting recovery. Depression can feel isolating, but it's a treatable condition, and you're not alone. The first step is reaching out to a professional for diagnosis and guidance. Learning about treatment options, medications, and therapies empowers you to take an active role in recovery. Finding the right approach may take time and patience. What works for one person may not work for another. Open communication with your healthcare team is key. Recovery isn't always linear, but persistence pays off. Knowledge reduces fear and gives you control over your journey. Whether for yourself or a loved one, understanding treatment is a powerful step forward. Keep asking questions, seek support, and remember, recovery is possible. The path to wellness begins with knowledge, and you've already started.